hundreds of thousands of people losing coverage across the country. Are you one of them? Well, did you get that letter? I don't know. Did you call up your insurance company to find out? Did you get your new ID card? I don't know. Well, you need to do that. And that's what we're there for. And what we do, Ron, is we don't charge anything to have a conversation with us. Whether you call us on the phone or you come to our office, there's no charge. We're here to help you. That's the bottom line.
Hello, everyone. I'm Ron Roel. I'm the host of 45 Forward, where my mission is to help you make the second half of life even better than the first. In today's show, I'm talking with Joe Battaglia, the CEO of Senior Services in North America. For Joe, the story of Senior Services all began with a postcard about Medicare. Joe didn't just answer it, he built a thriving nationwide business from it, dedicated to helping people understand one of the most confusing systems in America, Medicare. Today we talk to Joe not only about Medicare, but about how his three-legged stool, Social Security, Medicare, and retirement planning solutions can help you build a stable foundation for your future. And it's an important time because the future right now is really uncertain. Joe Battaglia, welcome to the show.
Well, thank you, Ron. Thanks for having me on. I appreciate it. And every time I hear a story like my story with that postcard, I'm like, wow, that really is true. So thanks for bringing it up because I always recognize that, you know?
Yeah, let's start with that. You've intrigued me with this story, and it shows to me, how you need to look at life and be ready for accidents and take advantage of them. Just tell me a little bit about that postcard.
Yeah, so opportunity knocks, right? They always say that. Look for things, and I always throughout life always have my eyes wide open, always listening to things, listening to ideas, because you never know what turns up. We always know the very successful people. They weren't just launched into something. Something passed their way, and they had this idea, and they saw they can make things better, and right, they ran with it. And that's the same thing I did. I got a postcard in the mail, and it spoke about Medicare, some new programs that came out back in 2006. So in 2007, these programs actually hit the market. And when I saw it, Ron, I knew it was something because healthcare is very expensive in this country, right? It's a major topic of concern for everybody, young and old, and everything in between. So when I heard what it was all about, I said, wow, this is pretty good. I always thought about providing solutions for people. That's what we do, provide solutions. And unfortunately, a lot of people aren't there to provide the solutions to the ever-growing senior marketplace. So when I saw that, I said, wow, this is it. And, once I get involved with it, and I really seen how it really helped the senior population, I really ran with it. And at that point, I started recruiting agents more and more across the country to where we are today, and one of the largest in the Northeast right now. But, we have thousands of agents who are utilizing our product lines and our services to help out tens of thousands of seniors every single year. So it's very rewarding for me to look at my humbling past where I started and where we took it to today. And we're always reinventing ourselves every single day because we look at what does a senior need, and from there, we look at what solutions are out there to help them because there's no one spot for everything for the seniors. They have to look here, they have to look there. So we said, let's put everything together, and that's what we really accomplished. So we're very proud of that.
Obviously, Medicare is front and center because this is the open enrollment period. But let's just take a step back a little bit and talk about your holistic approach because this is what I like. This is what I think about at 45 Forward. It's like, well, what do people need in various aspects of their life, not just financial? And you've taken that notion to your particular niche. So you talk a little bit about your holistic approach of looking at Medicare, but also how does it fit into Social Security, other kinds of retirement solutions.
So when you look at, the retiring employee, the retiree, whatever it may be, once they hit that age and, they work all their life and now they come into retirement, they're supposed to enjoy themselves, but there's a lot of constraints, Ron, a lot of constraints. And financially, they really affect them. Whether it be their Medicare or health insurance concerns, the number one reason for bankruptcy in this country is, unfortunately, is healthcare. So with the spiraling costs, it never goes up the cost. You never go into the hospital and you look at the bill and say, wow, how come so cheap? It's always, wow, look at this, right? So we know that, right? So is there ways to help with that solution? The answer is yes. Now, are there other people that could help people with this? Of course there is. But that's where we started the whole other aspect of what we do because that's where most agents stop. They stop at that Medicare portion, right? But what about everything else? Because Social Security and financial, that's that three-legged stool. And we came up with that concept because if everything is not right on a three-legged stool, you're going to fall over. And what that literally means is, what do you do in retirement? How is it going to work for you? So we take this holistic approach, meaning that everything counts. It's not just one thing. How can you leave a retiree or a senior just there and say, I took care of your Medicare, see ya? That's not good because one thing affects another thing. So we really took this approach to look at what does everything look like? How do we cap their cost? How do we reduce their exposure? How do we make sure they have a wonderful retirement? Because most don't. The numbers out there show a lot of people aren't doing very well in retirement anymore. So because of the planning, and like there's that old phrase, nobody plans to fail, but if you fail to plan, well, you have a problem. So we take this approach that we're here, right? We're here to help you with every concern that you have, and we're doing very well with that, Ron.
Well, let's talk first about Medicare, this confusing matrix that's facing us. And right now, of course, there are lots of uncertainties going forward, but there's lots of, probably, misinformation about it. So let's just talk a little about what should people expect? What should they be doing now? I know you deal with looking at their plan, looking at their potential, but whether a Medicare, Advantage plan works for them. So what should they be thinking about? And what changes should they be looking for?
What they're going to look for right now is they're going to probably a lot of people receive letters saying that their plan has been terminated, right? Unfortunately, right? And people say, why? Why was it terminated? Well, that's the insurance company's decision. It's not ours. But there are solutions. So we want everybody to know that don't worry. There was a solution at one time and you have that plan. There's a solution now. You'll have another plan, right? So you don't have to get frantic. We're going to find something for you. But the idea is, insurance companies raise premiums, they raise copays because they have to make sure they're making money to cover their costs, right? Because healthcare is expensive, not only for the senior, but for the insurance company. So because of that, they have to pass along expenses somewhere, and that's what happens, right? So now this person, goes on to Medicare. They've been on for a few years. Now they get this letter that the plan changes. Now we're in the open enrollment season where they can look for changes. But I got to tell you something, a lot of people don't know. We speak to so many seniors that say, I didn't get that letter when they did because it's the insurance company's responsibility to make sure they get it. And they did get it. So now they don't have coverage starting on January 1st and they just have regular Medicare. And that's a big no-no. You don't want to do that because you're subjected to lots of copays, deductibles. When you go into the hospital, the sky's the limit. That's no good. So there are other ways to cap the costs like they first did, right? So it's always important to review. The AEP season is a season to review, but a lot of people don't. They feel comfortable because nothing happened. Well, what you must look at, Ron, is that every year plans change, right? Some change for the better, some change for the worse. But the idea is you need to look at how has your plan changed? Because a retiree or seniors, their health may have changed. Their medicine requirements may have changed. Different things happen. So if you don't review, what you're doing is you're leaving your healthcare up to a surprise. So when you have to use it, you get surprises. How could that be? And that's when people call into us and say, how could this be? Well, you didn't review. But there's not a lot of people out there trust the resources to do that for them. And that's we're this unbiased, trusted resource for the senior population. So we do a great job of it because we really take the seniors' best interests into concern. And we look at the carriers that are out there to find out one that matches their need because there's no one size fits all. You have to look at the one that makes sense for you. So that's what that looks like.
Right. So some of the big changes, right? So there are changes in Part D, right? There are more drugs that are available through the Medicare negotiated prices, right? So that's one big change, right?
What you look at right now is this year, used to have Part D plans that were low as somewhere $10, but now they're $100 because they went up a lot. Prescriptions, they're just very costly. And it's very important for a senior to have that because if you don't want to pay the premium for something because you feel it's too high, watch what happens when you have no Part D. You're going to get a penalty anyway, not for having the Part D. But what's going to happen is how do you go and shop around for retail on these medicines? They're crazy, the prices of prescriptions nowadays. So you need to shop around with that Part D plan. And, a lot of different things people can choose it depending on their requirements. Like what we do when a person comes to us, we say to them, what are you looking for? What are you trying to accomplish? And it all boils down to money too, Ron. They want to make sure they can afford it. And we always say to them, you want to have the most comprehensive coverage and you want it to cost as little as possible. And we understand that. We all want that. But the idea is sometimes it's not available. Depending on your prescriptions that you take, depending on the doctors that you go and visit, we have to look at those changes every year because things change. And when things change, your plan will change how it's going to cover you. So that's important. We have to take a look at that. And that's what we look for them.
I just want to mention, too, you do have a free report, right? How to avoid costly mistakes when choosing a Medicare health plan.
Yeah. So what we have is we do this comparison report. And it's really cool because you look at what they have compared to what is available to them. And it looks at all the different plans available in their particular area, and it'll show a side by side comparison. For a person to do this on their own, they'd have to call up each insurance company and go through the summary of benefits, which is a very daunting task. And they have to look and itemize every single thing. How much is a primary care visit for this one, and this one, and then do the same for outpatient visit. There's a whole summary of benefits with all different coverages. So it's a real daunting task for a senior to do. It's very difficult, but we make it simple. And with our software, you just upload all the information, doctors, hospital medicines, in a very confidential way, and it'll tell us everything what makes sense to the person. So they'll know what they want to do. It's all about choices, but if you don't know the choices exist, how can you really use the choices, right?
So now blending Medicare with income, retirement income, we have Social Security, and then there's also wealth management. So how do you talk about these two things? So everyone now, of course, is all worried about Social Security. It looks like that it's not going to disappear, but it's in jeopardy because there's more money going out than coming in. So
exactly.
What is your thought about Social Security in terms of how much
Social Security will be here? It's just a matter of they change, whether it's bend point changes. I don't get too technical right now, but the idea is that they might raise certain premiums. There's different things they could do. It's not going away. Statistics show us, I think in 2033, 77% of the benefits will still be given out, right?
Right, correct.
But that's before they do changes. So they're going to do some kind of change. What it's going to be, we don't know. And look, the population is aging, so you have so many people aging and not enough workers, so they can't pay the retirees. So that's what happens with Social Security. But what's really confusing with Social Security, Ron, it has over 2,700 rules and regulations. So when a person retires, the major thing they think about is, oh, I'm 62, I can retire. Oh, I'm 65, I can retire. I'm 67, I can retire. Or do you wait till you're 70 to retire? It's all about that optimization of your monthly benefit check. And that all depends on different things, right? We have to look at your working years, what kind of income you have coming in now, because taxation comes into play too. Are you going to collect off your spouse? So lots of different things to look at. But what we do is we have what's called a roadmap. And the roadmap actually takes us through this journey. And it gives us different scenarios. If you retire at 62, remember, that's not your full retirement age. You're not getting your full benefit. Right now, it's 67 for most people. That's when you get your full retirement, right? The full benefit. But if you stay, it's 8% every year up to age 70. So do you want to stay? Well, that might be a strategy if you don't need the money, right? That's okay to do that. But what if you need the money now? What do you do? So that's different things to look at. And then there's another concept to look at, which a lot of folks don't realize is, most people, I think it's like 45% of the people on Social Security, that's like 50% of their income coming in. Now, just think about one thing. If one of the spouses passes, right, well, you get the highest monthly benefit, but you lost that other half, right? So if you couldn't live, if you're 50% you're living on, when one disappears, how do you exist with that now? So a lot of people didn't even think of that concept, but you must think about that concept. See, Medicare, if you don't plan right, well, you'll be subjected to high co-pays, deductibles, high spiraling healthcare costs. If you don't optimize your Social Security, there's a figure out there of $110,000. And what that is, that's the actual money that's left on the table. That's according to Social Security. That's the average money left on the table from people who don't optimize their monthly benefits. So what you have to look at is, how long does it take a retiree to save up $100,000, right? A long time. And now you're in retirement. What do you really do? That becomes very difficult, right? So that's why this holistic approach, when a senior understands this, they start saying it makes a lot of sense, and it certainly does. So so you got to look at those rules and regulations and optimize that. So the first step is your Medicare health insurance to make sure you choose a right plan. It's got to be right for you, whether it's a Medicare Advantage or a Medicare supplement plan with a standalone Part D. But again, we look at that, right? Because different needs for different folks. And then optimizing your Social Security is so very important, right? And again, we provide those roadmaps for them too. So that's something that can help them also.
Yeah, so you optimize your Social Security, but in many cases, it's still not enough. I mean, a lot of people, rely a tremendous amount, but especially in high-cost areas like we are on Long Island, you need to think about the third leg, which is wealth management solutions. So let's talk about how that works with Social Security.
Yeah. This unfortunately is the most important aspect that you have to look at because it's all about the money. if you don't have money to take you through your livelihood, right? When you retire, what are you going to do? Because they look at, statistics will show us, and they can vary here and there, but let's say you're going to live 30 years, right? And let's say the optimal income for you to live is $50,000 a year. So if you take the $50,000 a year, times it by 30 years, you need $1.5 million in savings. They don't have that, right? We know it's so low, the savings rate in this country, right? So what happened is now is, and it's an odd kind of situation, but that's what's out there. While a person is working, they're accumulating their assets, right? You're working, getting employer matches if you have that way. So you're accumulating your assets, right? And then what happens is you start to retire, and maybe you're edging towards retirement, maybe 3 years to retirement. And now you start to hold back a little bit on how aggressive you are with your investments, and rightfully so, because you don't want to be, playing Russian roulette with your retirement. So the idea is, so now you start holding back, right? Okay, and now you retire, and hopefully you have your Medicare all in place, your Social Security is optimized. But let's talk about that wealth. Once you retire, you're in a decumulation phase. So you're not earning no more. You're not investing no more. Now you're taking money out. Now, we look at that $50,000 and times it by 30 is 1.5 million. The idea is most people have $200,000 in the bank. So how do you live? And another thing is, what's really frightening is, if you work 25 years of your life, right now we know that in the stock market, it's very erratic, very fragile. Things happen every single day. People look one day, oh, I'm up. Next day, oh, I'm down. So you can't have that up-down mentality in retirement. While you're in the accumulation phase, well, that's one thing. But when you're in retirement, well, that's something you got to really consider now, because what do you do? Think about this. Think about all the people. Let's look at COVID, right? Back in 2020. So let's say people working 20, 25 years, they had hundreds of thousands of dollars in a 401k, and now they retire, right? And they retire now when? They retire in December, right? And then in January, so December of 2019, and in January 2020, we have COVID. And now look what happened to the market after that. It took many, many years to rebound. And not to get too financial technical, but the idea is something called sequence of returns. And what happens is if your portfolio is down in the beginning years, you're not going to recover. It's not going to happen for you. So you don't want to be subjected to that. So, everybody has their financial advisors, and they have a great place to helping the seniors. They really do. But unfortunately, nothing is guaranteed. With Medicare, you have Medicare health insurance to guarantee your health, right? With Social Security, that provides a guaranteed foundational income in retirement, right? So that's a good thing to have, right? Because you got COLA adjustments, all that, that's fantastic. But now you're in retirement, right? So your 401k now becomes an IRA. What do you do with the market during downturns? Because it's going to happen, right? We know that the past is not indicative of the future, but we do know history repeats itself at times. And the idea is we know that, you know what, you're going to get these bear markets, and bear markets are really, you have to watch them because, you have the upticks in the market, right? And they last for years and years and years. But suddenly you have these downturns, these bear markets. These bear markets can last 12 to 15 months, but they drop sharply. And again, if those sharp declines are happening, the sequence of returns in the beginning of your retirement, that can be devastating for your portfolio. So you're never going to achieve the money that you need. So what we look at, are there things, right, that can really help ensure your portfolio? And like I always say to people, Ron, is that, there is no one product that's good for everything, right? A person needs to be diversified. That's the bottom line, right? So there is a place for financial advisors to be helping them and counseling them, and finding the right one is very, very important. One that's going to answer their phone, one that's going to console you and guide you in downturns to know what's going on. But what we look at it, there are ways to guarantee a portion, meaning that you're not subjected to any downturns. If the market drops down to zero, your portfolio still stays where it was. And there's something incredible out there called fixed index annuities that are really incredible. Billions of dollars of assets go into there every single year. And what makes them so unique is they guarantee your investment. It can never go down. When the market goes up, you participate in a portion of the upside. But if the market ever goes down, you never lose a dime. and they're guaranteed by the insurance companies, right? So you're not just putting money in an insurance company and hoping they're going to be around. They're guaranteed, and those funds are in reserves for you, right? They're regulated by states too. So they're very regulated insurance products, right? They're not investment products. So what we look at is, how do we take this holistic approach now? So you have financial advisors out there that are doing a great job, but they're not helping them with Social Security and Medicare, right? So what we look at is, how can we put everything together? And that's how we came up with the three-legged approach.
So in terms of sequencing of this, it seems to me so Medicare, obviously you can't take that until you're 65. So that's not really the first step, but it's part of the thinking of the first step. So I don't think people, first of all, as they look ahead toward Medicare, it's like understanding what the costs are. So first of all, they don't understand that Medicare covers 80% of your costs. So there are going to be healthcare costs, and so first thinking of like, what are my healthcare costs going to be? What is Medicare going to cover and what they're not going to cover? But then, before you're 65, it seems to me you're saying somebody should be talking to you about, they should look at their Social Security. How much is that going to cover? What's the strategy there? And then how does that need to work with your other retirement options, investment options and insurance options?
Yeah, that's exactly right. That's exactly it, Ron. You have to look at, if you can't leave. Most people, they're not taught about this. No one's, when they're working in their HR staff, they're not educated. In fact, what we do, we educate a lot of HR directors across the country, because this topic is so important. Because a lot of people, either they're not working because they're married and they stay at home, whatever it may be. But what about the workforce that's out there? Now, once they retire, well, they've been working with HR directors all their life for all their benefits. They go to them. But the HR directors, they don't know that that's not their thing, right? So what we really have built relationships with many HR companies, HR staff across the country, to help position those retirees. They have like a phone home, a people to call to help them with that. Because, if the HR folks are not educated on this, when the retiree comes up to them and says, hey, what do I do concerning my Medicare, my Social Security? They're going to say, I don't know. Call up Medicare, call up Social Security, go on Google, go look for somebody. And that could be devastating. You make the wrong choice in the beginning, that could be very devastating. So we really put together a very easy, stress-free kind of situation. And whenever we talk to people, there's no obligation. Come and talk with us. We have our office. They stop by. We sit down, have coffee and donuts, whatever it is, and just chat. And whatever they're comfortable with. But we're really primarily focused on education, because that's very important. If you educate people, well, that's good, because we need to spread the word. So we educate somebody, a senior, they tell another friend, and that's how we all make it together.
Yeah, I know it's your philosophy. It's educate first, sell later. So I
Yeah,
like that. Yeah,
yeah, absolutely. You have to do that. It's very
Right.
important, Ron.
So talking about this education, I know that one of the things that you're renowned for, Joe, is also, a training of your staff and recruitment of staff. So, I think that's important for people when they select people to work with. They have to trust them, and one way to trust them is to really see how they treat their people. So, talk just in the last segment here, just talk a little bit about how you work with people, how you recruit people, and this philosophy of training through trust.
So what we do is we have meetings, and we just reach out to insurance agents across the country, because there's a fact that's out there around it. There's not enough agents to handle the demand. With 11,000 plus seniors a day turning 65 and becoming eligible for Medicare, there are not enough agents to handle the demand. And in the coming years, 80 million people, 20% of the population of the United States, will be on Medicare. So there's not enough agents to handle that demand. So, we reach out to agents, and we just share with them this opportunity that's there. But it's not just an opportunity. What it is, it's very rewarding in what we do, Ron, because, we as an agency ourselves, we help out tens of thousands of people every single year. So it's incredible, the number we look at. But we help them out, and we show agents that there's so many people that need to be helped, right? And we put them through training courses and stuff like that. We really make sure that, first of all, you got to be compassionate. You have to be empathetic. You got to make sure you're taking care of the seniors first, because that's what it's all about. And they do that. And we monitor what they do too. So we make sure that they have cutting edge software that we have, the technology that we give to our agents, to make sure they have what it takes to help out that senior who needs solutions. It's all about solutions driven. And then what we also do is our staff. What we do is to reach out to our insurance agents to make sure they're helping people the right way. But our staff is very agent centric and also customer centric. So what we really do is we make sure that our phones, somebody's always answering the phone. You know, one thing I hate, Ron, and nowadays nobody answers their phone. But if you should happen to text them, they'll text you back. How could that be, right? So the idea is we make sure our phones are answered all the time. And I'm the CEO of my company. I tell people you can call me up from 8 o'clock in the morning to 8 o'clock at night. I answer my phone no matter where I am in the world. I answer my phone because it's important to me. So whether it's my staff or whether it's a retiree just has a question, an HR director, whatever it is, we're there to help the people. Not sometimes, but all the time.
So, last couple of questions I have for you is, first of all, any surprises or things you've learned along the way that you didn't expect?
Wow. Surprises along the way. Let's think about that for a minute. So I don't know if I was ever surprised with things because I'm the type of person that, when something comes, if it's adversity, well, I find it's like a challenge for me and I find the solution to make that work. If it's something that is just doesn't make sense anymore for some reason because of some regulatory issue or something like that, of course we don't go down that road anymore. But we're always looking for things. So I don't think if anything ever, got me rattled or stuff like that because, we're in a space right now that people need help. And if you're giving unbiased help to people, you never have to worry about a thing. So I don't think I'm ever surprised with things. Do you have to at times reinvent yourself to help people better depending on certain economic climates and things? Yeah, of course. But the idea is we always move forward and it always works for us.
So, looking forward from the consumer's perspective, anything they should be thinking about going forward? And I mean, you've mentioned, a few things, but, you know, any changes in the landscape that we should be prepared for?
Well, you look at every year as far as Medicare, there's always costs being changed, always, right? So it's very important. And, seniors, retirees are very skeptical about change, right? Because they don't want to change. And I get it. But the idea is you have to look at what you're changing from. If something makes sense, and as many times, we talk to people and we tell them, you know what, you're on the right plan. You're on the right plan, Ron. Stay where you are. There's nothing you need to do, right? But most of the time, they're not on the right plan. So we help them with that, right? So whether it's Medicare or Social Security or just the retirement planning, right, strategies to help people with, it's always there. So, surprises only happen if you're not prepared. And the idea is we're always prepared. We always prepare that retiree for what could happen. And we share with them, if this should happen to you, well, this is what your costs are going to be. So if you should happen to go in a hospital with this particular Medicare plan, this is what you're subjected to. Are you okay with that? It's not that we just tell them, we rattle off what the benefits are. Are you comfortable with that? That's what we have to tell them. Whether it's Social Security, did you optimize it? Did you navigate all those rules and regulations to find out what makes sense for you? Are you leaving money on the table that you can't get back? You made your choice. You can't get that back. So we got to make sure that's right. And then as far as, your retirement, the money, everything is about the money, unfortunately. And is it about, we hear so many horror stories about people just existing out there, right? They can't do certain things. They don't go out. They don't travel. Retirement is supposed to be a happy time. But we find out a lot of times it's not. Statistics will show us that. 1 in 10 people, 1 in 12 people will never retire, right? So that's kind of 10% of the population is never going to retire. That's pitiful. How many people are part-time workers? That's a lot there. 30 to 40% are part-time workers. So the idea is, when does it stop? Is there something that can be done? And that's what the planning in advance. So what I really tell people, Ron, is that don't be scared. You have to find a resource that's out to help you. And what we always tell people, we're not here to sell you anything. We're going to educate you on what this is all about. We're going to look at it holistically. And if you feel that this is going to help you, right, then we're here for you. We can help you enroll in those things because we're out here to help you. So it's very relaxed in what we do, Ron. So we're very proud of that.
Yeah, my motto is plan but don't predict. So
That's
I
right.
think that's
Yeah.
but people are reluctant to plan. It's like they'll do
They
anything but
are.
plan.
They
So
wait till tomorrow, right? And
yeah,
tomorrow's here.
yeah,
What do I do now? I
right,
should have done it, right? How
right,
many I should have's do you hear from people all the time? The
right.
times now do it, especially with
Yeah,
Medicare. Now is the season, so you
yeah,
should be looking at that.
right, yeah.
In different parts of the countries, a lot of plans they're terminated now. What do? Hundreds of thousands of people losing coverage across the country. Are you one of them? Well, did you get that letter? I don't know. Did you call up your insurance company to find out? Did you get your new ID card? I don't know. Well, you need to do that. And that's what we're there for. And what we do, Ron, is we don't charge anything to have a conversation with us. Whether you call us on the phone or you come to our office, there's no charge. We're here to help you. That's the bottom line.
So last thing is contact information. So how do people reach you? Tell us about your website. And
So our website is seniorservicesofnorthamerica.com, seniorservicesofnorthamerica.com. You could also call us toll free at 888-230-2199 or my personal number, 516-884-2238. And again, if you call, we can show you the comparison, right? The Medicare comparison, different plans, how yours stacks up to others out there. And if you could save money with your prescriptions, money on your copays at doctors and hospitals, that makes sense. We could help you there. Social Security, if you're just retiring now and you want to optimize it, we could provide that roadmap for you to show you which scenario makes sense for you. And then finally, just guaranteeing your investments, right? So we have to take a look at that too. So everything's a holistic approach, but if you take everything and dissect it and put this plan together like you talk about, Ron, it works. That's the bottom line.
And I think that one should think about doing it before you think you need to do it. That's why my show is 45 forward. People say, well, the second half of life, and I say, well, and they say, well, why 45? And I say, well, there are two reasons. One, think about things before you hit the 50-yard line, because it's important to get ahead of that. And the other aspect of it, I use this sports analogy, which is, if you want to throw a football the farthest distance, what's the angle? 45. So start thinking about these things a little ahead of what. Don't wait till you're 55 or 65. Start talking to Joe a little earlier, and then when you get to Medicare, then you can make that decision.
Absolutely, Ron. Absolutely, it's all good. But hopefully today we provided some solutions for folks, and we're here for you. That's the bottom line. Absolutely. But it's all good, Ron.
So thanks, Joe. I really appreciate you talking with me today. A very valuable, informative conversation. And if once again, so would you prefer emails as well, or just phone?
Just give me a call. It's all good. You can call me.
Good.
Yeah, it's all
Very
good.
good.
Absolutely.
Very good. Okay,
it's all
good.
All
right. Okay. So once again, folks, this has been 45 Forward. If you want to see a full archive of my shows, go to 45forward.org. And if you want to send me comments or questions or ask me anything about, provide suggestions, you could also subscribe to my monthly newsletter. So until then, our next episode, folks, keep moving forward, 45 Forward.